Hello guys, my name is Brohanu Badadawari. I'm doing my presentation on sexual abuse and the influence on adult sexual relationships. What's sexual abuse? Piper and Taylor give us a general definition in their book, Sex and the Supremacy of Christ, that all misuses of our sexuality that distorts the true knowledge of God is sexual abuse. God intends for our sexuality to be a pointer and outlook of our relationship with Him, and these sexual activities and behaviors we see here are examples of sexual abuse. Sexual abuse can also be an older individual imposing inappropriate touch on a younger child, exposures to pornography, sexual scenes, joking or negatively responding about sex and sexual development, forced sexual violations, and forcefully engaging in touching sexual genitals. Sexual abuse can also be defined as any sexual act, attempt to obtain sexual act, unwanted sexual comments, or advances or acts to traffic a person's sexuality using coercion, threats of harm, or physical force by any person in any setting, regardless of relationship to the victim, in any setting, including but not limited to home or work. In sexual acts between an adult and a child in which the child is utilized for sexual satisfaction of the perpetrator is also sexual abuse. Sexual abuse can also be violation of the child's body through oral, anal, or genital penetration. Sexual abuse occurs whenever one person dominates and exploits another person by means of sexual activity, or suggestion. When we come to sexual abuse prevalence and history of treatment, we can see that both men and women are victims of sexual abuse, even though the percentage of women victims tend to be higher. 1 in 4 women compared to 1 in 6 men before they turn the age of 18. The national US statistics data is quite alarming. Perpetrators are people in all relationship levels, with the victims fathers, relatives, parents, mothers alone, mothers and a person, teenagers, adults, even older perpetrators. It appears that all people from all ages can be the worst enemies of their own kind. The most common sexual abuse happens during childhood by family members and people closely related with the victim. Children who suffer the sexual abuse once are more susceptible to be abused again before they become adults. There is a lack of reporting of abusive encounters by both men and women victims due to fear and shame. More than half of sexually abused children showed symptoms of PTSD. Studies that show that the majority of sexually abused children received treatment. In the past, even when sexually abused children met the diagnostic criteria of PTSD, scientific-based assessments and treatment procedures were not provided to help the children and their families. PTSD did not appear in diagnostic classification systems such as those of the American Psychiatric Association until DSM-3 third edition came out. Different literatures offer different information on prevalence and treatment of child sexual abuse. Sears et al. Explain that although the literatures provide a wealth of information on correlates of sexual abuse and sexual function in people with a history of child abuse, currently no model takes into consideration the interaction between characteristics of the abuse, family factors, and cognitive processes, including schemas. That means they saw a gap in the existing treatment approaches. And on impact and influence of sexual abuse, Piper and Taylor explained that In the wake of sexual abuse, sex becomes like life in Auschwitz, like a burn survivor, a waking nightmare of hurt, fear, and the hopelessness from the hands of tormentors. The experience of violation can lead the victim to self-labeled as damaged goods. Sex becomes intrinsically dirty, shameful, dangerous. Marriage can become unpleasant duty, a necessary evil, not the delightful convergence of duty and desire. The thought of sex might be filled with loathing and despair, the farthest thing from lustful desire. And according to Konzen, internalized message of fault, guilt, worth, and the desire to hide body with baggy clothes effect on close relationships, low self-worth, sense of feeling damaged or perverted, flashbacks in daily life or during sexual activity, physical discomfort and pain in the vulva, little or no interest in sex, and problem with arousal, erection, and orgasm, numbing out during sexual activity, avoiding sex or having out of body experience during sex and having difficulty enjoying sex, experiencing high anxiety and then high negative feelings about sex and sexuality. Sex is dirty, guilt, or fear in expressing sexual preferences, suppressed anger that reduces desire, and distressing flashbacks, powerlessness during sex, lack of sexual assertiveness, high difficulty communicating about sex, or withdrawal emotionally during sex, conflicted feelings about sex, feelings of no right to sex enjoyment but just learning to endure sex, doubting God, having problems with sexual touch. There is also a prevalence of dissociative experience and PTSD among those with high history of sexual abuse. Lev Wiesel identifies 5 dissociative symptoms of sexual abuse. Amnesia, described as memory holes or lost time. Depersonalization, a sense of being detached from oneself, a sense that the self is alien or unreal, a sense of being separated from different parts of the body or the body as a whole, or a sense of being detached from feeling of altogether. Derealization, a sense of detachment or estrangement from the environment, or sense that the world and the surroundings are unreal. Identity confusion, a sense of fragmentation of the self that is unnoticed by the surrounding people, and identity or alteration, noticeable change in identity or more than one ego state. Child sexual abuse can lead to negative self-schemas, which can have greater negative effect on anticipation of sex and may result in sexual dysfunction and low sexual satisfaction. Hall et al. Also identify several symptoms of sexual abuse: higher level of depression, guilt, shame, self-blame, body issues and eating disorders, cited as a long-term effect of childhood sexual abuse, feeling dirty or ugly, dissatisfaction with body or appearance, eating disorders, and obesity. Somatic concerns. Most frequent medical complaints are cited to be pelvic pain, gastrointestinal problems, headaches, and difficulty swallowing. Stress and anxiety. Dissociative patterns. Survivors of sexual abuse may dissociate to protect themselves from experiencing sexual abuse, and when they feel unsafe or threatened, may result in feelings of confusion, feelings of disorientation, nightmares, flashbacks, and difficulty experiencing feelings. Denial and repression of sexual abuse. Relationship problems. Difficulty in establishing interpersonal relationships, difficulty with trust, fear of intimacy, fear of being different or weird, difficulty establishing interpersonal boundaries, passive behaviors, and getting involved in abusive relationships. Sexual problems. Sexual symptoms include avoiding, fearing, or lacking interest in sex, approaching sex as an obligation, experiencing negative feelings such as anger, disgust, or guilt with touch, having difficulty becoming aroused or feeling sensation, feeling emotionally distant or negative or not present during sex, experiencing intrusive or disturbing sexual thoughts and images, engaging in compulsive or inappropriate sexual behavior, experiencing difficulty establishing or maintaining an intimate relationship, experiencing vaginal pain or orgasmic difficulties. Sexually abused person can become sexually avoidant, which means exhibits diminished sexual expression, increased sexual anxiety and fear of sex, negative attitudes towards sexuality, and increased sexual dysfunction, or can become hypersexual, which means engaging in risky sexual behaviors, have multiple partners, and over-sexualized relationships. May also risk secondary factors such as unwanted pregnancy, lack of contraceptive use, and increased sexually transmitted infections. Konzen lay out professional and traditional treatment approaches with the goal of helping survivors to release themselves from blame, understand that the perpetrator is responsible, and learn how to stay in the body and enjoy sex. Konzen also recommend that if counseling is not readily available, using biblical principles to reclaim God's view of sexuality makes a big difference in the sexual abuse survivor's journey. Understanding effect of sexual abuse, re-examining sexual beliefs, learning God's intention of marital sex, learning how to remain within the body, and finding ways to deal with intrusive images and thoughts are of great help. Here are some more recommendations by Hall and Hall. Assessing the effect the abuse has on the client's current functioning and how the client currently copes. Working with the client to increase their ability to accurately externalize the abuse. Increasing their sense of control and help decreasing level of depression and anxiety. Helping survivors feel safe to encourage disclosing their childhood sexual abuse. Relationship building techniques, encouragement, validation, self-disclosure, and boundary setting. Building feelings of trust, safety, and openness. Client empowerment techniques, helping survivors process, uncover, and express anger appropriately, attribute sexual ability, responsibility, establish boundaries, and promote self-efficacy and power. Relationship skills, especially with a partner, to enhance and develop intimate relationships. Addressing general psychological problems. Resolving feelings about abuse. Gaining skills in areas such as assertiveness and self-awareness. First step in sexual healing is to help the survivor connect their current sexual problems with their sexual abuse in the past. Sexual symptoms that come from past sexual abuse are sexualizing relationships, inappropriate seduction, difficulties with affection and intimacy, compulsive sexual behavior, promiscuity, problems concerning desire, arousal and orgasm, flashbacks, difficulties with touch, and sadistic or masochistic tendencies. Treatment should focus on understanding how the sexual abuse influenced their sexuality, adjusting sexual attitudes, gaining a more positive sexual self-concept, decreasing negative sexual behavior, learning how to cope with negative reactions to touch, and developing skills to positively experience touch and sexual intimacy. And here are my references. And some more references right here. That's it. Thank you so much, everyone, for your time. I appreciate the course as well. It took me quite a while to finish this assignment, but it has been an amazing experience learning even how to do this, and also understanding more on the sexual abuse and its impact and influence on the adult sexual relationships. Thank you so much. Have a great time.